I knew from a fairly early stage of my training that I wanted to be a surgeon. I think probably because I was quite technically minded. I liked doing things with my hands, and I moved into orthopaedics. And it was within orthopaedics that I got sent to one of the oldest nerve injury units in the country, and I fell in love with that surgery. Because we deal only in this area, it's very rapidly apparent to me what the problem is. The question is how I put that over to the patient so they understand and have confidence in my ability to take them on the next path of the journey. Once they know that I know what I'm doing, then we can talk about other things and move on to operation if necessary, or explanation why that's not necessary and things will change or recover. And then you can talk about other things with people, and my patients are interesting. They come from all sorts of walks of life, and you generally meet interesting and interested people. So that's another big aspect of the job that I very much enjoy. So the most rewarding aspect of my discipline, which is peripheral nerve injury, is I think the immediacy of results in some cases, and then the opportunity to build a relationship with people over a longer term when we have chronic conditions or conditions that take a long time to recover. And nerve injury can be that way. So sometimes we have early success that makes a big difference to people's lives, particularly when you get people out of neuropathic pain rapidly. That makes a huge difference to people's lives. And then sometimes we're reconstructing after serious nerve injury, and that takes a lot longer. But then you build up a relationship with people and they come on that journey with you. And that's very rewarding to see if you've seen someone 2 or 3 years later and they've got their life back on track, they're back able to work or able to return to sport or some activity they've not been able to do for the last 2 or 3 years. That's hugely rewarding, and one of the main reasons that dragged me into this specialty, really.